Hello, I'm Lucy Hetherington. I'm the Senior Research Assistant at Pearson Clinical Assessments, and here with me today is Dr. Reena Vohora. Reena is a clinical psychologist and academic tutor at the University of Oxford. Reena, if you could start by just telling us a bit more about yourself and the work that you do.
So I first became interested in working with older people back in 2015 in my first assistant psychology post, where I worked with older people in community services. Since then I've worked in a range of memory clinics and worked with older people in inpatient settings, so kind of acute hospitals, but also longer stay assessment and treatment wards, and also rehabilitation services as well.
Okay, wow. Lots of experience. So in your opinion, what do you think are the main issues faced by the ageing population in the UK currently?
I think it's important to note that actually with advances in medical kind of treatments, we are an ageing population, so people are living a lot longer, which has, lots of positives. We know that older people are able to live very healthy and fulfilling lives, and play a really, active role in society as well. So it's important to remember that people do age or can age well. But on the flip side of that, we also need to think about some of the difficulties that can arise in kind of older age as well. So if we think about the statistics, currently there's around 12 million older people over 65 within the UK. And interestingly, there's been the fastest growth in people over 85. And over the last 15 years, there's been an 85% increase in people living to over 100, which is I think really interesting and fantastic. So I think when we're thinking about the changes in demographics, we also need to think about the support needs that older people may have. So it's important not to see old age as a period that's necessarily associated with ill health. But I think we do need to think about how we support people in a holistic way, thinking about mental health difficulties that older adults may present with. So we know that older adults potentially living alone may be more likely to have a mental health difficulty and seek help via their GP surgery. So around 50% of older adults presenting to GP surgeries have a diagnosed mental health difficulty. So these statistics are from the Royal College of Psychiatrists. We know that 60% of people in general hospitals have a mental health difficulty, and that's even higher in people within residential homes. So we do need to be thinking about people holistically. And I think something that's really, really important is thinking about loneliness and social isolation and how we support older people with that. So there's the campaign for loneliness, which has really highlighted some of the difficulties that older people may face. So when we're thinking about social isolation and loneliness, I think we really need to be careful about the differences and what we mean by that. So when we're thinking about social isolation, it's more around the objective number of social contacts that somebody has, whereas loneliness is more around somebody's perception of the quality of the relationships and the difference between their contact with people and what that feels like for them, and also what they may feel that they need.
Could you tell us a bit more about what this holistic approach looks like?
So from the perspective of a psychologist, one thing that's really, I think, unique to psychologists is that we think about the person as a whole, and in terms of using formulation. So that's really to get a better understanding of the person. So this is where we would consider, as I was saying, the interplay between mental health and physical health, and really get to know the person. I think one thing that we don't often do is consider somebody's strengths. So that's also then when we're thinking about somebody that we're seeing in clinic, in hospital, it's about looking at why they're presenting, so what difficulty they're having, but also the resources that they've had to get them through their lives to this point, and strengths that they can use to deal with some of the difficulties that they may be presenting with as well. So within that, it will be around thinking about somebody's emotional and coping style. It'd be thinking about somebody's kind of previous mental health history and background, their physical health history, also about their context. So actually, who have they got within their social network, who's at home, what's important to them, what are their values. So through formulation, we're really able to understand what's important to this person to be able to treat people as an individual, to be able to offer person-centred care.
Okay.
And the way that we do that, so in the current team that I work in, so I'm a psychologist, so we work with physiotherapists, occupational therapists, speech and language therapists, and we work together to think about the person as a whole. So I work in a neurorehabilitation service where we see people who've had strokes, brain injuries. So when somebody comes to us after a stroke or a brain injury, we're really thinking about all of those factors, and we set goals that are meaningful for that person, and relevant disciplines will become involved. So we're thinking about this person holistically. So it's not necessarily that everybody will have a physiotherapist or everybody will have an occupational therapist or a psychologist. It's about identifying what's important for that person at that time and then deciding on what disciplines need to be involved. The goals are always set kind of based on what's important to that person at that time. So it could be anything from, we've had grandparents wanting to gain more confidence and learn skills to be able to read to grandchildren again. We've had people wanting to be able to retain their independence in terms of being able to go shopping, but struggling with managing money after a stroke. So again, as psychologists, then we've worked very closely with occupational therapists in terms of doing cognitive assessments and grading approaches to help people to return back to activities that they were doing. We've had people wanting to go back to places of worship or to return to work. So the way that we work would be very much based around what's important to that individual.
Can the loss of cognitive function, is that something that can be prevented or delayed?
So that's a really interesting question. So often what people will say when they're starting to experience difficulties with memory is, you know, this is just a normal part of ageing and I don't need any help with it. And you know, I think we need to acknowledge that we do expect some level of cognitive decline as people age because of the way that the proteins and the blood flow to the brain and how that might be affected as we age. However, memory loss is not an inevitable part of ageing, or developing a diagnosis of dementia is not an inevitable part of ageing. In terms of thinking about where we're at the moment, there is no cure for dementia, unfortunately. There's lots of research that's going on. We know that there are medications that can help to delay the progression, and we know that people can live very meaningful and fulfilling lives after a diagnosis of dementia for several years, but that can't be prevented as such. In terms of thinking about delaying potential difficulties or, you know, active actions that people can take, we know that there are particular risk factors that are associated with developing certain forms of dementia, so thinking about vascular dementia, multi-infarct dementia, and also risk factors that are associated with stroke. So, for example, having high blood pressure, high cholesterol, high levels of alcohol consumption, smoking, you know, having high-fat diets. So in terms of what people can do, in terms of reducing those secondary risk factors, I think it is about encouraging people to be more active, to live kind of healthier lifestyles, and this isn't about cutting out you know, everything that might make life fun. So we're not saying that people shouldn't drink or, you know, shouldn't treat themselves in terms of their diet. But I think it is about having a balance and moderation, and encouraging people to be active. So I think when we're thinking about activity, it's around physical activity that we know is really helpful for to reduce cardiovascular risk factors. But also, you know, if we think about endorphins that are released during exercise, and thinking about strength and balance that can be improved through exercise over time as well, I think that's really important. But also cognitive stimulation. So often we would encourage people to carry out activities where they're really using their thinking skills. So it's almost like physiotherapy for the brain, if you like, is sometimes how we describe it. And there's, you know, this hypothesis of use it or lose it. So encouraging people to be active. So sometimes people will do quite specific activities like Sudoku or crosswords or brain training apps. And what we know is all of those are really helpful in terms of keeping people active and people using their cognitive skills. And I think it can have really positive effects on mood as well. So again, this is not saying that this is going to prevent an onset of dementia potentially later in life, but all of these factors can be really helpful and really important in kind of, people becoming more active.
Okay, nice. Keeping fit and healthy.
Yeah, I think it's, again, thinking holistically, it's about kind of physical health and mental health, and we know that being active is really important for people's mood as well.
Okay, so you've spoken a lot about the sort of things that we can do throughout our life. At what point are we able to bring in these healthier habits that might help? Like, are you able to do that later in life if you, once the cognitive decline has started, or is it something that we need to have been doing our whole life to see the effects that you're speaking about?
I think it's never too late to make any changes. I think even for people that might be kind of 65 and above, it's about thinking about different opportunities, and often retirement can provide people with extra time to maybe take up activities that they may have wanted to do previously but may not have had time when they were working. So I don't think it's ever, too late to start making changes or start thinking about, taking up new activities and being socially active. So the British Psychological Society have produced some guidance on healthy retirement. So we know retirement can be a risk factor for some people in terms of developing difficulties with mood, and maybe people sometimes struggle because they don't have that same routine, or they're not cognitively challenging themselves as much as they previously might have at work. So some of the tips around retirement and supporting kind of healthy adjustment is around making social connections. As humans, we like to be connected to other people, so those relationships are really, really important. So developing interests and being creative, taking up new activities, trying to have a structure, I think that's really, really important. So again, people making that transition from work to retirement might struggle with not having as much structure or plan to their day. So having things to look forward to, I think, is really important. Learning new skills, so taking up hobbies. There are lots of services out there as well that people can engage with. So Age UK run a range of different types of courses and things like cafes and opportunities to meet. There's the University of the Third Age, which is fantastic, where people can go and kind of sign up to different topics and learn different areas. So I think there's lots of opportunities out there for people. I think we could be better at maybe signposting people and raising awareness of that. But I think it's never too late to make a change.